This is QD Clinic. Hi, I'm Dr. Jack Cush with roomnow. Today's QD Clinic is brought to you by roomnow's virtual ACR 2020 coverage. You give us 2 hours, we'll give you the ACR. Today's case is a discussion of which IL-1 inhibitor should I use. I treat a lot of patients with autoinflammatory disease. I'm a self-declared king expert of Still's disease. That's because no one will fight me for the title. And I use a lot of IL-1 inhibitors. You know, there's 3 on the market. There's rilonacept, which is given every 8 weeks. There's canakinumab, which is given generally every 4 weeks. And then there's Anakinra, which is given every day. So when I'm treating someone either with Still's disease or FMF or Schnitzler syndrome or hyper IgD syndrome, these are all IL-1 responsive disorders. The question is, which one do I use? Heretofore, I almost always use Anakinra first. One, because it's cheaper than the other ones. They're all really expensive these days because these drugs are indicated for very rare disorders, so that jacks up the price quite a bit. But I tend to use Anakinra because it's very short acting and has a half-life of 6 hours. It works pretty quick, and it also is dissolved pretty quick, meaning when you stop it, its effect goes away and people will flare within 1, 2, 3 days on Anakinra. The other ones are antibodies, monoclonal antibodies, which have a much longer half-life. So again, previously I would use Anakinra as my starting drug, and once the patient had gotten used to daily injections of Anakinra and had done well, then I would switch them over to canakinumab, usually either when they complained of daily injections or I was concerned about compliance or the insurance companies were giving me a hard time. The equation changes more recently with the FDA approval of canakinumab for adult Still's disease. It's actually the only drug that's approved for adult Still's disease. Now, there are, again, the other IL-1 inhibitors. Anakinra is approved, as you know, for use in RA and also for CAPS, the cryopyrin-associated periodic syndromes. And then canakinumab is also approved for systemic JIA, the CAPS, FMF, hyper IgD syndrome, and TRAPS. And rilonacept is only approved for just CAP disorders. So when treating RA, you have an FDA approval for Anakinra. When treating Still's disease in the kids, or adults, you really only have an FDA approval for canakinumab or Ilaris. Again, the differences here are the half-life, 6 hours for Anakinra, 26 days for canakinumab. And so the dosing regimens are either daily for Anakinra or every 4 weeks for canakinumab. The doses are 100 or 200 milligrams given daily at night with Anakinra. I use it at night because most of the fever occurs at night and it's a very short half-life drug. Some people will require 200, and that's higher than the prescribed dose. But when you're treating hot, red, inflammatory, systemic autoinflammatory disease, you might need higher than normal doses that you would use in RA or other disorders. When you're using canakinumab, the dose is either 150 or 300 milligrams given every 4 weeks. Now, these are sub-Q administered drugs. They do have the problem of ISRs, injection site reactions, that usually go away after a month or so, and they're never serious adverse events or hospitalizable, or the lesions are usually just red, elevated urticarial but not itchy lesions, and not mild discomfort that again will go away with repeated injections. So which one do I use now? That's really the big question. I think it depends on what the need for rapid control or chronic control is. I think the onset of Anakinra is an advantage, but its disadvantages is a daily injection. And you have to rotate sites, and patients don't usually like to inject their abdomen that much, and they run out of sites on their legs, and God forbid they're using their upper arms or buttocks. But if I'm looking for chronic control, maybe I can acutely control the condition with steroids. Often if I'm using an IL-1 inhibitor, I'm usually using a background of methotrexate or another DMARD. And then you could use canakinumab as your first drug as well. If you're fighting the fight with insurance, for FDA, that this is not an approved drug, well, then your only option for Still's disease is going to be canakinumab, because it's not approved for Still's in kids or in adults with Anakinra. So that's my 2 cents on IL-1 inhibitors. Again, tune into Room Now for expanded coverage of the ACR 2020 meeting. If you only had 2 hours or 4 hours to review the ACR, and you can do it asynchronously, you can do it at night or during the meeting or in the morning before the meeting, it's all going to be online. How would you do this? I mean, you can go to the ACR website, it's going to be good, or you can go to our website, roomnow.com, and see perspectives by key opinion leaders, see a lot of videos, a number of podcasts, panel discussions, takeaway messages, all on video or audio, and then there's going to be written content by our faculty of over 24 people covering the meeting. So tune in the Room Now, starting November 1st all the way through the 13th. We'll talk to you tomorrow on QD Clinic.